Our topic this evening is Smile, the new face of today's dentistry, with my guests, Dr. Richard Gray and Rachel Dorr, hygienist. Let's now segue on into Invisalign. The only thing I really know about Invisalign is it's a replacement for braces. And I know you'll correct me if I'm wrong. Seems like when I was in high school, 98% of the kids had braces for 1 year, whether they needed it or not, it seemed like. And braces comes with its whole set of issues, right? I remember rubber bands and sore jaws and sore mouths. So Invisalign, what is it? What's it used for? When did it come out?
It's been around for almost 20 years now.
Wow.
It's less a replacement of braces and more an alternative to braces.
Okay.
So what it is sets of plastic trays that fit over your teeth. And the trays are designed to put pressure in specific areas and specific ways to move the teeth the way you want them to. Instead of using brackets and wires, you're using plastic trays to move the teeth. Some of the really big benefits of it are it's less noticeable, which most people like. If you're an adult in particular, if you have an important meeting, if you're going on a date, if you have some big event, you can take them out. And they also allow you to eat whatever you want. You don't have to be careful about eating popcorn and sticky stuff. You can eat what you want, and you can also keep your teeth cleaner because you take the trays out and you can brush and floss like normal, whereas with traditional braces, get stuff stuck all over the place.
There are copycat systems of Invisalign. You use Invisalign at Poudre Valley Family Dentistry, right?
Yeah.
Is there a reason why you chose that brand and you stick with it?
I am really dedicated to using things that have stood the test of time. Anything that's been around less than 5 years, I tend not to trust a whole lot. And even 5 years is kind of pushing it for me. I really want to use products and services that
are past the experimental stage, right?
Exactly.
They'll do what we think they're going to do.
Yeah.
Because they have experience, right?
I can have confidence they're going to work. So yeah, there are a number of companies that do similar things, and they may or may not work fine. I haven't tried them because I really have much more confidence in the big original system.
What kind of dental issues do you like to use the Invisalign on rather than braces? And interestingly enough, before we went on air, I told you I was talking to a friend of mine. She asked me what the show was going to be tonight. And I said, it's going to be so cool. I have Dr. Richard Gray on and Rachel is hygienist, and we're going to be talking about sedation and Invisalign. She says, I have those on. Now, I'm looking at the most gorgeous set of teeth, you've ever seen. And I said, why are you wearing Invisalign? And she said that she got them because she grinds her teeth at night. So I thought Invisalign was just to straighten things out and make all your teeth straight and beautiful and pretty and shaped right. So apparently there's a lot of uses for these.
Yeah, sort of the ideal case for Invisalign is sort of minor crowding and minor tooth rotation problems. For example, if you had ortho back when you were one of those teenagers running around with all your friends in ortho for a year.
Exactly.
And you at some point during college, you lost your retainers and never got new ones. And now you may be in your 30s or 40s or 50s and your teeth are starting to drift and crowd again. That's an ideal situation for Invisalign to address. There are certain more complex cases that Invisalign isn't as appropriate for. And as far as the teeth grinding and clenching situation, one thing about teeth that most people don't think about is the forces on the teeth. Everybody knows about cavities, and a lot of people know about gum disease and periodontal problems.
Root canals, you got to throw that in there.
That's right, yeah.
We all know about root canals.
You're scaring people, Lindsay.
No, I'm not, because we can cure it with sedation, so don't worry about it.
Perfect.
Yeah, you don't need to be scared anymore.
Don't be scared.
The third way you can have problems with your teeth is inappropriate forces on your teeth. And they're aligned ideally, and your upper and lower teeth meet correctly. The forces on the front teeth and the back teeth are different, and they protect each other from forces that are bad, and the whole system functions together in a very efficient way. And so one way to address teeth that are undergoing, negative or detrimental forces is a bite guard, and that'll keep them safe at night or, whenever you wear the bite guard.
Right.
But if you want to keep them safe all the time, you can move them around to get them in that ideal relationship. And that's where Invisalign is another option there. Instead of just putting plastic between so that the grinding isn't hurting your teeth, you can move the teeth to where they're supposed to be so that they're not damaging each other.
I have a mouth guard because I grind my teeth at night. Mm-hmm. Do I have to worry about protecting my teeth in the daytime too?
It all depends. We always look for evidence that you're doing damage to your teeth. So if I back up a second, if your teeth and your jaw is like a chewing system,
Okay.
It's the same as your ankle. If you go out and sprain your ankle and then you just sit on the couch for a week, you aren't going to have a problem with your ankle. But if you try and walk, your ankle's going to hurt and you're going to have problems. So your teeth could be misaligned and in the wrong place. But if you're not grinding or not grinding much, you may not do any damage. And so we look for things like cracks. We look for things like notches along the gum line. We look for things like unexplained cold sensitivity, wear, flat spots on the teeth, chipping of the teeth. There are a whole set of signs that a person may not notice themselves, but we see really easily and right away that tell us if you're doing damage to your teeth because they're not positioned correctly.
So in my case, my guess is that I keep my teeth moving almost constantly during my waking hours, which shouldn't be much of a surprise to anybody. So
shocking.
I know. So that's probably why I just have the mouth guard and not the Invisalign.
Yeah, and you know, for instance, in your case, we don't see all those different things that would indicate you're destroying things.
How long does somebody typically wear Invisalign? I'm figuring that depends on how bad the condition is. But is there like a general span of time? You don't have to wear this your whole life, do you?
No, but you'd need to wear retainers for your whole life to keep it where we put it. But the Invisalign treatment would the types of cases we would treat would generally be about a year. Sometimes, you know, depending, it may be less. It all just depends how much movement needs to occur.
So you said something interesting, that all of my friends who wore braces and got all their teeth fixed, now that we've got some age on us, our teeth start moving again. Do they continue to move our whole life?
Yeah, they move all the time. There's a ligament that attaches your tooth to your bone. So they're not just anchored in bone. So any kind of persistent force on the teeth will cause them to move. So even clenching and grinding can cause teeth to move.
Chewing and eating and all that stuff.
And teeth tend to drift forward with time. So that's why a lot of people notice their lower front teeth, which have very small roots, start to crowd over time because those small roots don't hold them in place as well as larger roots do.
Dr. Gray, you do know that this is exactly what happens in horses, and we use this to tell how old horses are by how prominent their teeth are moving forward and how long in the tooth, which is where that expression. So my teeth are going to continue to move
Your
forward.
teeth are beautiful.
I happen to know the right people to go to for beautiful teeth. What are some of the most common questions and concerns that people have about using Invisalign? Because to me, it sounds really like the thing to do. It's almost like those teeth bleaching trays, isn't it?
Yeah,
is that what they're kind of like?
Yeah, they're pretty much the same shape as a bleaching tray, except instead of being soft and rubbery, they're real hard and rigid.
Yeah, because they have to do their job, whatever that may be.
Exactly. The frequently asked questions that I hear are just what you just asked. How long? How long is this going to take? Do I wear them always? Usually at night after you've finished your treatment, and that's just going to be to maintain them. That's the same as if you and all of your friends back in the year of ortho, if you would have kept your retainer on at night from here on out, they might not have those changes. That's what we're hoping for. And so with Invisalign, we're going to put them back or get them to where they need to be in optimal occlusion. And then you'll just put those on at night, just wear them at night to keep them there. But it's an easy thing compared to having all the brackets, the wires.
Right.
Ugh.
And the neck braces that they used to have. And plus, you're paying for this now, not your father.
Right, the headgear.
So right. You're going to be far more diligent in keeping this going.
That's right.
Right.
Do they hurt when you first start wearing them? You know how braces used to hurt at the beginning until you got used to them?
Yeah, you'll have some soreness, but most of the soreness from Invisalign comes from the actual tooth movement. So you'll have that achiness in the teeth, but you know it's not like wires or sharp metal things will be poking you in the cheek or anything like that.
Not cutting up the inside of your mouth.
Yeah.
So in a way, the hurt's good because it lets you know that it's working?
Yeah.
Right?
Could we say that?
Yeah.
Right.
Yeah, certainly.
Oh, that's very cool. Are there a lot of people doing this? A lot of older people doing this?
There are, actually.
I've been really amazed by how many older people are not only interested, but actually go forward with it. It's actually pretty common. You know, people get to the point where their kids are done with college and they say, I want to do something for myself. Or they get to the point where we're starting to see some bad things happening with their teeth and they're thinking about, you know, boy, I am planning to live until I'm 90. I want to make sure I can eat the foods I want to eat and stay healthy that way. So I better do something about it. You know, those kinds of things are things we see pretty commonly.
Plus what we try to explain to people is it's not just about pretty, because we used to think braces are just
Right.
to make
That's
your
what we
teeth
all
pretty,
thought.
but it's really not. If you have the correct occlusion, Dr. Gray said something to me the other day. If your teeth are in the proper place, it just naturally looks great, but it's actually functioning so that you're healthy. It helps prevent some periodontal issues that can come up through no fault of your own. You're taking great care of your teeth. You're doing everything you need, but if your teeth are bashing together unfavorably, it creates problems. And so this just kind of helps get all those problems under control.
It makes
So it's
sense.
really nice.
Yeah, and that's kind of, getting back to what we were talking about earlier, is that we tend to emphasize what looks good, and everybody wants a pretty smile. But yeah, just like Rachel was saying, if you have a functional system, sort of the byproduct of that is a nice smile.
It looks good too.
Mhm.
Yay.
Yeah. So that's an extra
Bonus.
attraction.
Who couldn't love it?
Yeah.
What's the procedure? We come in and I say, Dr. Gray, I'm not really happy about this. What can I do about it?
Well, we take a quick look and do an evaluation. We look at your bite, how much crowding or spacing you have, how much any of your teeth are rotated, and we, decide, yes, you're a good candidate for, Invisalign treatment. And then if you want to go forward with it, the next visit would be to take some photographs and impressions of your teeth, and also a set of x-rays so we know where your roots are. And we send all that to Invisalign and tell them where we want to move the teeth and how. And then they put it together and send back actually a virtual animation of your teeth. So you see where it started, and then you watch each aligner and where it moves the teeth. And then I look at that and I say, yeah, I like this, but I don't like that. And I tweak it a little bit and send back revisions. And then when it looks the way I like, then we bring you back in and I go through that with you and make sure that meets your expectations for what you're looking for.
So we get to see kind of a timeline of what's going to happen to. Oh, that is
exactly.
really cool.
So you get to see what the end result is going to look like
before you
you start, which is really nice to be
and
able to do.
encouraging, I bet. Encouraging as can be.
Mm-hmm.
Right.
Yeah, it's very motivating for people to be able to see that.
So then they send you, what, 3 or 4 trays or however many trays it's going to take?
They produce the whole set and send them all to us. And then you come in and we give you 2 to 3 sets of trays at a time. So you'll be wearing the trays for, a week to 2 weeks each.
Okay.
And then after that period of time, you'll, toss the old tray and put in the next one. And then you'll come and see me every 4 to 6 weeks. And I'll look for how the teeth are moving and evaluate whether everything is working the way we expected. If it's, if things aren't moving quite right or they're taking longer than we thought, then we'll have you wear the trays for a little longer each time. And you may come and see me more frequently. And if things, if it's going along and we aren't seeing what we want to, we may take new impressions and do, what's called a correction to get things back on track. And, so we pretty closely monitor the whole situation as it's going.
Fascinating.
Mm-hmm.
This is part, we didn't talk about this. This is part, I think, of your relationship dentistry that you practice, right?
Right.
You build such a fabulous rapport with your patients, whether they're going there just for a cleaning, I can vouch for that, or this Invisalign process, it really sounds not only fascinating, but very motivating and rewarding.
Yeah. And we, with the relationship piece of what we do, we all really believe that we can't effectively work with you to get you to the point you want to be unless we really know who you are and what you want. And we always start off with new patients asking, what are your goals for your teeth? And what kind of experience do you want to have when you come to the dentist? And, some people say, my teeth are fine. Don't, tell me if I have a cavity and that's it.
And keep them here.
Yeah.
Right,
Most people say they want to keep them for life. That's
Right.
right. And some people say, I need them whiter. I need them to look better. And I need this, that, and the other thing. And that tells us immediately what people want to hear about. So we'll always tell people what our findings are, what our concerns are. That way we understand people's preferences and how to talk to them in a way that makes sense to them.
Yeah.
And people really find that helpful. And we've seen a lot of people who have had a history of, dental anxiety or not liking the dentist or saying, every time I come in, something's wrong and I don't like that. And we've been able to turn a lot of those people around just because we're meeting them where they are instead of telling them a bunch of stuff they don't want to hear.
And you also talk in a language that they can understand. One of the biggest fears is not understanding you, not knowing what's going on.
Right.
Mm-hmm.
I think everyone that at our office is committed to making sure that our patients, we want to have that relationship with you and we want to give you a quality experience. So we're all trying to do that. And whatever that takes, we try to, like Dr. Gray said, meet you on your terms and say, how can we help you understand this? What can we do to help you and talk to you? That's partly why I think our patients feel at ease with us, is because we are just trying to figure out what they want and help them get there.
And we also make a real concerted effort to talk in colloquial terms and use language that non-dental people understand.
Right.
It's true.
You won't hear us using a lot of fancy words and confusing jargon when we talk to you about what we're seeing and what the options are.
Right.
And I think people really appreciate that too.